objected to if it's excluded or changed. I like the exchanges, and the reason I like the exchanges is it's kind of a form of bidding. It's more transparency. People can see what they're buying, and that would be a big help. When we were in the shoe business, my wife used to, after 10 years, she decided she'd bid out our insurance. We didn't know there was that much flexibility in insurance. She saved a bunch. And then, of course, she didn't, since we were selling shoes, it's kind of a fixed price, so she didn't really take the low bid and then go back to somebody else and say, can you make this a little lower? But that insurance company we'd been with for 10 years came to us and said, we could have done a better deal. She said, you should have when I was buying the insurance. And we got much better bids the next year. So these exchanges can be good. But what I would hope you would consider is having the exchanges to list anybody's insurance that wants to put it on there, and then mark the ones that meet the federal minimum standards, so that people can decide really what's out there in the market. And I think it would pull up some of the ones that are lower down up into the category, and at the same time everybody could see what all's on the market out there, and hopefully regardless of states. Thank you, Mr. President.
Thank you very much, Mike, and thanks for staying succinct. Thank you very much. And I thought you shared some important ideas there. Tom Harkin.
Mr. President, thank you again for bringing us together today. I think, if anything, what I've learned here so far is that, quite frankly, we may be closer together than people really think in actually getting agreement that we can move forward on. I hope that's the case. There's been a lot of figures thrown out here and a lot of process things, but I keep thinking we've got to bring it back home to what this is all about. We all have our stories. I got a letter yesterday from a farmer in Iowa. It really encapsulates it. I'm a 57-year-old Iowa farmer. I'm writing to voice my concern regarding my family's rapidly escalating health care costs. On Saturday, February 20th, I received a notice from well-marked Blue Cross Blue Shield of Iowa informing me that our health insurance premium will be increasing $193.90 per month to a monthly total of $1,516.20. This is a 14.6% increase and will result in a yearly cost of $18,194.40 for a family of 4. 10 years ago, our monthly health insurance premium was $373.50 per month for a similar policy, which had a lower deductible and covered 3 additional children. Health care costs are out of control, and as a self-employed individual, I feel powerless. At the current rate of increase, by the time I reach Medicare age, my premiums will cost $42,000 per year. As a farmer, I manage risk on a daily basis. Weather, weeds, insects, and fluctuating commodity prices. I have not yet found a way to control my exposure to health care expenses. Because of pre-existing conditions, I've been denied access to coverage under more economical insurance plans. Therefore, I'm stuck in an expensive pool and have few options. The best option would be for the U.S. Congress to pass comprehensive health care reform, resulting in affordable health care for all. The health of my family and the future of my small business depends on it. Sincerely, Raymond Smith, Buffalo Center, Iowa. Mr. President, I hear talk about, well, we got to start over and do all this thing again. You know, we spent 1 year considering a range of ideas from experts from all over the political spectrum. 2 committees, the Health Committee under the able leadership of Senator Dodd, the Finance Committee under the leadership of Senator Baucus, held over 100 bipartisan meetings and walkthroughs to discuss this bill. Our bill contains over 147 distinct Republican amendments. Now, on the issue of health insurance reform, of the 10 key elements in the House bill, we have 9 of them in our bill. 9 out of 10. That's not bad. The only one that's missing is the health savings accounts. But 9 out of 10 are in our bill that are in the House Republicans' bill. Now, again, those, what are they? You know, again, pre-existing conditions, we covered that. No rescission when you get sick. No lifetime annual caps. No gender-based ratings. Keeping your kids on until they're age 26. That's in the House Republican bill. That's in our bill. So I think we're very close on this. Last two things I just want to address myself to is this idea that somehow we can do a little bit. We can take an incremental type of an approach. Somehow we can do insurance reforms, but we don't have to do anything else. Well, quite frankly, if we want insurance reforms, you can only do that if everybody's in the pool. You can only get everybody in the pool